Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more.
Hey everyone, I'm a Millennial Mechanical Therapist, and today I'm talking about my thoughts regarding how PTs should be approaching most of their patients. Now, you guys know that we have been mainly using the mechanical and diagnosis and therapy approach. That's what most of our videos are about and kind of what our website displays mostly. That's just our preferred approach, and it's not necessarily the right approach. And I think by now you've seen multiple videos where we've said that, you know, we're not necessarily doing it right, but we're doing what just kind of clicks with us, what allows us to accomplish the things that I'm going to talk about today. I think that a lot of times in our profession, in a manner of speaking, we kind of miss the forest for the trees a lot, and that really comes out to me in terms of we try to go super in depth in a lot of different kind of explanations on things and try to make that the point of physical therapy. The problem with that is that it just gets way too complex, and then all of a sudden we have these huge turf wars about who's right, why you're wrong, why he's wrong. We've had a couple videos that talk about this so far, but today I'm more so talking about how I kind of approach the oversimplification of what we should be doing. And the idea behind it really is just that somebody walks in with a problem. That's kind of it. The idea is that you're there to troubleshoot that problem with them, and it doesn't have to be this extremely complex explanation of why things get better or exactly what's going on the inside and things like that. Now, when you get that extremely complex patient, things change a little bit, but for that 80% of people who fit into that derangement category that we think of, or for other folks it could be rapid responders or people that just do well in general with therapy, you know, for them, does it have to be such a complex situation that you explain, or can you just say that whichever school of thought you kind of subscribe to, is that going to be enough with a basic explanation to them? So when you get with one of your patients and you find that within 5 minutes their pain changes rapidly and their function improves, well, are you moving something out of the way, as is kind of thought in a derangement syndrome where the anatomy is disrupted, or are you just desensitizing the central nervous system or the peripheral nervous system and allowing things to maybe glide a little bit better or smoother? Along those same lines, is it just a biomechanical situation where the arthrokinematics have improved because of what you're doing? You know, all of these ideas and philosophies come right around to the same idea. You know, we all got different trees in the same forest of us getting someone back to what they want to do and reducing their impairments. Along the same lines, I think that we kind of get a little bit too caught up in a goal of being pain-free as opposed to a goal of making things extremely tolerable. You know, a lot of us wake up every day in pain. It's just a fact. And when I say us, I just mean people. I wake up every day in pain. The guy I work with wakes up every day in pain. I'm sure you wake up every day in some kind of pain. You think back the last week and go, have I been pain-free the whole time? That's extremely unrealistic for anyone. So our expectation to have a patient be completely pain-free is almost borderline absurd. It's such a tough thing to get truly pain-free all the time, anytime. Now, the important part is when you provide your education to that patient that relates what pain is and how it acts, and just really reassuring them that pain does not equal damage. Hurt does not equal harm. So as we go through all these things in the therapeutic realm, we want to make sure that we don't necessarily lose sight of what our true simplistic goal is, which is just helping people rather than trying to impress everybody with what we know, or trying to say that other people are wrong because the idea doesn't work, when in reality some of the patient stories and things, they're there of improvements. Now there's a line, and I know a lot of us have heard some really wacky stories that are out of left field, and those aren't the ones I'm talking about, but things that have a consistent basis for improvement. I don't think that they should be set to the side or poo-pooed too much and things like that. As long as you are educating your patient, empowering your patient, and helping them to improve their function, whatever you do should be pretty appropriate, as long as you're not doing any harm along the way. So thanks for tuning in, guys. I know that coming up more and more on the next few weeks here, Joe's going to be talking about continuing that series of using repeated motions after surgery. Really interesting stuff. Tune in. It's going to be great. As always, guys, move your patients early, move them often, and move them to end range. We'll see you next time.